What is Todd's paralysis after an epileptic seizure? Imagine experiencing a seizure and then feeling suddenly weak or unable to move part of your body afterward. That's what Todd's paralysis is. It's a temporary weakness or paralysis that happens after a seizure, especially in people with epilepsy. This condition is named after Robert Bentley Todd, a doctor from the 19th century who first described it. Todd's paralysis usually affects just one side of the body. It might involve the arm, leg, or face. Sometimes it can also cause speech difficulties, vision changes, or eye movement problems. Importantly, it always occurs after a seizure and does not happen on its own. If someone has weakness or paralysis without a recent seizure, it could be caused by other serious conditions like a stroke, and medical help should be sought immediately. The symptoms of Todd's paralysis show up during the recovery phase after a seizure, called the post-ictal period. You might notice muscle weakness, numbness, slurred speech, or changes in vision. The paralysis can be partial, meaning only a little weakness, or complete, where movement is impossible. Usually, these symptoms go away on their own within a few hours, but sometimes they can last up to 48 hours. The length depends on factors like the type of seizure and if there is any underlying brain injury. Scientists believe Todd's paralysis happens because of temporary changes in brain activity after a seizure. One idea is that the brain's motor cortex, the part responsible for movement, gets temporarily exhausted after the electrical storm of a seizure. This leads to a brief period of reduced function, causing weakness or paralysis. It's more common after focal seizures that affect one part of the brain but can also happen after generalized seizures. It's very important to tell the difference between Todd's paralysis and a stroke. While they can look similar, Todd's paralysis always follows a seizure and resolves without treatment. A stroke, on the other hand, is not linked to seizures and needs urgent medical care. If someone experiences sudden weakness or paralysis without a clear seizure history, they should seek emergency medical attention immediately to rule out serious issues like stroke. There is no specific treatment for Todd's paralysis. The main focus is on supportive care, making sure the person is safe, comfortable, and monitored until the symptoms improve. Managing epilepsy effectively to reduce seizure frequency is the best way to lower the chance of experiencing Todd's paralysis. If symptoms last longer than expected, or if it's the first time experiencing this, medical evaluation is essential to confirm the diagnosis and exclude other causes. For people with epilepsy and their caregivers, understanding Todd's paralysis helps in being prepared for what might happen after a seizure. Knowing that temporary weakness can occur and that it usually goes away on its own can help reduce anxiety during recovery. Still, any new or unusual symptoms should always be discussed with a healthcare professional. In summary, Todd's paralysis is a temporary, seizure-related weakness or paralysis that resolves without the need for specific treatment. Recognizing it as part of the post-seizure recovery process emphasizes the importance of seizure safety and ongoing communication with healthcare providers. Always follow medical advice and seek personalized care for any concerns related to seizures or their aftereffects.